Hello, everyone. Good morning, good afternoon, good evening. Everyone from wherever you're joining, welcome you to Africa Youth Growth Foundation Suicide Prevention Month webinar. The theme is Creating Hope Through Action. And as we all know, with the ongoing rate of depression and economic crisis in the country, a lot of people are sinking into suicidal thoughts. And on this webinar, we have amazing panelists. So I'll start by introducing my panelists. We have Ms. Faith Osemeke. Ms. Faith Osemeke is the founder of Arts and Acts of Love, ARAL, couple relationship therapist who employs psycho-spiritual principles in her arts. She is the founder of ARAL, like I said earlier, a multi-venture. Her vision and goal is to use psychological and spiritual principles to address trauma, divorce in homes, marriages, and every relationship. She'll be discussing mental health issues as it affects our next panelist. She's an amazing woman. Her name is Mrs. Angela Omeiza of Jela Development Initiatives, a non-profit organization focused on providing access to clean water, hygiene and sanitation, voluntary blood donors, mental health care, therapy session where she organizes and reaches out to people, the leadership exchange programs dedicated to training young people on servant leadership and community building, as well as the gains. Is a Mandela Washington Fellow. Mrs. Angela will welcome you to our panel session, our webinar. And Mr. Dennis will be joining on later. Mr. Dennis is our last speaker. He'll be joining on later. He'll be joining at about 3:20 as he has a session going on right now. And so coming back to the issue around creating hope through our actions. The suicide rates, according to WHO, is very high. It rates that about 54% of suicide every minute. And so far, it means that every day, every year, we record about 703,000 deaths every year. And all this. And so today we'll be discussing how mental health affects and can lead to suicide in Nigeria. And so Mrs. Ozioma, over to you. She'll be discussing on the topic mental health and its effects in Nigeria. Welcome, Ms. Ozioma Faith Osemeke. Over to you now.
Thank you for having me.
Thank you so much and welcome to our webinar.
Thank you. As earlier introduced, I'm Osemeke Ozioma Faith, a psycho-spiritual therapist with Arts and Acts of Love. I'm glad to be here. Creating hope through action.
Yes.
I think a good place to start is psychoeducating us on mental health, mental illnesses, debunking myths around mental health, and directing people to the appropriate health professional for help. Mental health and its effect. When I hear mental health, I hear sound mind. It spells wholeness in areas of an individual's life, in their emotional, psychological, social, and if you're a spiritual person, spiritual aspects of their lives. We all agree that nobody knows what life throws at them. As we journey through life, you have traumatic experiences. Experiences like losing a loved one or being hit by a drunk driver, even if you're dotting your I's and crossing your T's on the road, and that impact might leave you with a broken arm or leg or physically challenged. All these traumatic experiences, when it befalls an individual, can leave the individual traumatized or not. The difference is in the art of processing one's thoughts, perceiving or processing your emotions, and eventually behaving appropriately. So I'll say, when we say somebody has, or an individual is mentally healthy, is when they can function normally, even under a stressful event or stressful period or experience of their lives. Let me give an example. Say a girl who starts off life early, determined, intelligent, goes for competitions with her peers, and at age 20, maybe now in the university, studying one of the good courses, maths and stats or medicine, and then gets traumatized or loses her sight. You see, that's a traumatic experience that can set her back, leave her feeling hopeless, or she can, through a little hurt or pain, little delay here and there, weather through the storm and continue with her vision. So you see, when she can continue with her vision through a traumatic experience and not be traumatized, we say what enables her to do this is her having a sound mind or being mentally healthy. What I'm saying invariably is somebody can go through a traumatic experience and not be traumatized. So if one goes through a traumatic experience and not come out traumatized, then we say the person has a sound mental health or has a sound mind. But then if the person comes out traumatized, or at any point where the person is traumatized, then we say at the point where the person is traumatized, it's either there is a mental illness present, or what we call mental disorder or psychological disorder, or there is a problem with the person's sound mind at the time. So what is mental illness? Brings me to defining mental illness or mental disorder or psychological disorder. All these constructs can be used interchangeably, but it's a health condition where an individual has issues with either the way they process their thoughts or their thoughts pattern, how they perceive or process their emotions, or they have picked up a lifestyle that is now affecting the quality of their lives. Who diagnoses these mental illnesses? Example of this type of mental illnesses is what we're going to be discussing today. Another speaker will be discussing today, but I like to mention parts or examples of these mental illnesses. Depression, as we all know, anxiety is one of it, anxiety disorders, autism spectrum disorder, we have obsessive compulsive disorder, schizophrenia. These are some mental illnesses that we can see around today. we understand that before you can diagnose somebody with mental illness, or who even diagnoses somebody with mental illness, let me branch there for a bit. There are a couple of health practitioners that have been trained to evaluate individuals, then diagnose and treat or help them cope with their day-to-day living. We have a psychiatric doctor. This is a doctor that is trained to alleviate mental illnesses by treating these mental illnesses, especially with medications, with drugs, since they understand the science around it. We have psychotherapists. Psychotherapists are taught to treat or help individuals cope with their day-to-day living using talking therapy or using therapies or tools that does not entail medications. So I'm saying medications are only used by licensed doctors to treat mental illnesses. Psychotherapists do not make use of medications while treating or therapizing their clients. Other health practitioners include mental health counselors, psychiatric nurses, even pediatricians. They treat some common mental illnesses. According to DSM-5, or DSM-4, which is a manual that's been given to health practitioners by American Psychiatric Association to help alleviate mental illnesses. There are symptoms that must be present and for a particular duration before you can say, okay, somebody has this particular mental illness or that particular mental illness. Let's use depression, for example. It's every now and again you hear people say, oh, once you've gone through a traumatic experience, maybe you've lost a loved one and you are really sad and you feel hopeless for 3-4 days, then your friend or your colleague or somebody around will just come and say, oh, you're suffering from depression. You need to see a mental health therapist, practitioner. No, not so. Like I said, according to DSM-5, first, you have to meet all the criteria in DSM-5 that spells depression first, and then before one can be said to be depressed. So aside feeling hopeless, very sad, you have things like lack of interest, apathy to what normally you would have had interest for, maybe eating disorders or sleeping disorders. So maybe usually you eat much or not, and now because of this impact, you now eat either too much or too little. Same applies with sleeping. Because of this impact, now you sleep too much or you have insomnia, you don't sleep. So there are a couple of symptoms that come together before any of these health practitioners that I've mentioned earlier can diagnose one with mental illness. So I'm just thinking of some myths around mental illness. You know how people will say, from my explanation, we see that if you do not rationalize your thoughts properly, if we do not have control over irrational thoughts, when irrational thoughts come to mind, you do not have control over them as they pop in. However, you have control over how you rationalize these irrational thoughts. Your ability to rationalize these irrational thoughts will spiral down to what you feel will have an impact on your emotions and then eventually your behavior. So if you rationalize your thoughts right, you feel the right emotion that will help you behave properly. However, if you stay so long in irrational thoughts, what will happen is you become very sad, or you have all the negative emotions, and which will impact your behavior. When it impacts your behavior, it will first affect you negatively. Then the people around you, your loved ones, to affect them negatively as well, since we are relational beings. What we do really affects the next person, and then it will eventually affect the society at large. So say I was born into a home where my parents are criminals, for instance, they steal a lot, and through social learning, I've learned, and now I'm a kleptomaniac, or I'm stealing, picking things around. How will this lifestyle now affect me? Whenever people see me, they see a thief coming. So they will relate with me from that glasses. See, it has affected me. Nobody wants to hire a thief, at least not any proper organization. They will not want to hire a thief. Your siblings or your relations around will feel very sad that they have a son, a daughter, a sibling that is now, or that is given to theft. Then the society at large, people's things will get missing and they will feel frustrated. So you see how people's irrational thoughts or them being mentally ill can spiral down to affecting themselves, affecting people around them, their loved ones, and the community where they live. We have myths around mental illnesses. Okay, let me draw a parallel between mental illnesses and physical illnesses. So, debunk some myths. We understand people who say things like, you're suffering from depression just because you lost your mom or because you lost an arm. Are you the only one? Why are you so depressed that you want to commit suicide? What kind of nonsense is that? Snap out of it. Or they'll say, oh, you're going for mental health evaluation. I don't think I can be around this type of person because it spells danger. I think you should be isolated. You cannot have a normal life and all of that. All of that. First of all, you see how you cannot tell a blind person, open your eyes and see. Can't you just start seeing? You see how you cannot say that? It's the same way you cannot tell somebody suffering depression, just snap out of it. It's called an illness for a reason. Reason is that they do not have control over an illness. You do not have control over an illness. So they cannot just snap out of it. They need trained health practitioners or professionals to help them, to give them tools that can help them, live their normal life or go back to normal factory recepts. Another myth is that people that have mental illnesses cannot stay amongst people. Now you see how, again, back to drawing parallel between physical illnesses and mental illnesses. You see how somebody can suffer from stomach ache because they have menstrual cramps. So when they have menstrual cramps and when their stomach ache is as a result of menstrual cramps, what possible treatments might be, take hot water or take Feldene or all of those type of treatments, because it's something not very severe. It's a mild stomach ache that will go after a while because of the process going on in the body. As opposed to stomach ache, where the intestine is perforated. You see, when it comes to perforated intestine or stomach ache caused by perforated intestine, at this junction, the doctor will have to give prescribed medications, if possible, even carry out surgery, as the case may be. So same thing with mental illnesses. It depends on, or the severity of the mental illness is what attracts or produces the type of treatment that will be administered. So if it is just any of the normal or very mild anxieties or mild anxieties or mild depressive disorders, maybe seasonal or occupational depressive disorder, then you can see a psychotherapist. They can use cognitive behavioral therapy or any of the tools to help you walk through your thoughts that can have a positive impact on your behavior. But then when there are mental illnesses like bipolar or schizophrenia and severe or schizoaffective disorder, any of these profound mental illnesses, a psychiatric doctor will have to administer medications. Of course, they'll evaluate the individual first, then provide medications alongside psychotherapy. So this is a biopsycho intervention, sometimes with social interventions, but bio interventions where the psychiatric doctor medicates while the psychotherapist helps one process their thoughts. Of course, all the other health practitioners or professionals, when whatever illness they are trying to get rid of or alleviate, when it's in its profound stage, they'll have to refer to a psychiatric doctor. Having said all this, are there warning signs to look out for? How do I know my neighbor doesn't need to be evaluated? Or how do I know I don't need to be evaluated? Or what are the warning signs? I like to call them warning signs to look out for. One warning sign can be distinct personality change. So when, for instance, somebody who used to be outgoing, is the life of the party, is swift to carrying out their jobs at work, live a normal life, all of a sudden switch to being introverted, shy, just being on their own, not talking, not even carrying out their normal day-to-day activities the way they usually will. And this has stayed for quite a while, a month, or maybe 3 weeks, or, then it's time for that individual to go for mental health evaluation. Another warning sign is extreme anger or hostility or violence. Maybe in the face of a little problem, for instance, say you're driving and somebody gets in your way and you just carry something in your car to hit the person, you want to burn down something, you're shouting, hitting the next person beside you, all of those hostile, violent activities, that person needs to get evaluated. Another one is strange, grandiose ideology. When you meet someone now in Nigeria and the person is telling you how that in 2 years they will become the American president and bring 897 billion vans to Nigeria and give everybody, and how that they will fly without wings, okay, this person needs to be evaluated. Another is extreme mood swings, where they can change their mood swing. This moment or today or this week, they are very energetic. They can carry out an activity that's supposed to take 2 days. They can do it in 5 hours. And in 2 weeks' time, they are so depressed that they can't even do anything. They can't even talk. They're just stoic, just in a particular position. And then after 1 week again, the circle continues, the mood swing. That kind of person needs to be evaluated. Another common one is extreme anxiety. Maybe you walk into a particular room and then you see somebody, you can literally see the person in there having palpitation, like their heart palpitating. You can see trickles of sweat coming down their head. You can see them really frightened. And then you're asking, what's wrong? And the person says, oh, sorry, I thought you were somebody else. And this happens very often. That type of person needs to be evaluated. These are some warning signs to look out for.
Thank you so much.
Okay.
so much. I know if I allow you, you go on and on and on, but we have time scheduled for this. But I also want you to throw light on what stigma surrounding mental health in Nigeria impacts individuals seeking treatment or support. What's your thought around it? How stigma around mental health in Nigeria impacts individuals seeking treatment or support?
Okay, first of all, people seeking, like I said, people seeking mental illnesses, when I was talking about stigma, they feel, people might look at them and say, okay, when they want to go for mental evaluation, people might look at them and be like, are you wacko? Are you crazy? It's only crazy people that go for mental illnesses. And because of this, they'll decide not to go for mental evaluation. Now, what happens is this mental illness continues to grow. It will impact them, their normal living. For instance, say somebody that is depressed or has symptoms of depression, not depressed, like the person is really sad and feels hopeless. And the person says, you know what, I'm not functioning properly anymore. I find difficult eating and sleeping. I'm just thinking, maybe if the traumatic experience was losing a loved one, and the person says, I find difficult eating and sleeping. And then they tell their friends, and their friends go, oh no, when you go there, they'll administer drugs to you that can make you mad or, you know, affect you negatively. Like the illness that you're suffering now will be ×2 when you go there and you're not properly diagnosed. So I don't think you should go. What happens is the person becomes further depressed, more depressed. And this depression can lead to the person committing suicide. So you see, if not treated, because of the stigma around it, if it's not treated, the person can, you know, recline to the point where the person can't commit suicide. That life is lost. And the life being lost now becomes a traumatic experience for their loved ones. So that can negatively affect the individual. Another one is you have extreme anger issues, for instance, and you do not go for evaluation because of the stigma around it. If you go for evaluation, people will say you are mad, and then, you know, for organizations that are not enlightened with mental psychoeducation around mental health, what will happen is they will think, okay, maybe it's time to lay you off or not give you some jobs to do because they think you cannot function properly. Then you decide, okay, I'm not going to tell anybody, I'll just keep on managing the anger. The anger can get to the point where when whatever core belief birthing this anger, when you have stayed in that irrational thought for a very long time, it can provoke you to act very violently, where you can kill somebody. And then when you've killed somebody, that takes you to jail. So you see how not treating these illnesses because of the stigma around it, as a result of ignorance, will cost the person and eventually cost everybody around. If that answers your question.
So thank you so much. Thank you so much, Ms. Faith. And we have a question. Mr. Clement has a question. So Mr. Clement, can you unmute yourself and ask your question? That will be the last question for this session. I will move on to the next panelist. Also, we'll be able to take just 2 questions, one for Mr. Clement, and after Mr. Clement, Ms. Rita, you ask your question. Hello, Mr. Clements. Hello, Mr. Clements, can you ask your question? Okay, Miss Rita, you can go on and ask your question. Okay, I think they have network issues, so we'll move on to the next panelist. Her name is Mrs. Angela Ochu-Baiye. Welcome to our webinar for World Suicide Prevention Month. And she'll be speaking on the power of talk and empathy in addressing mental health challenges. Mrs. Angela is a Mandela Washington Fellow from 2019. She is the founder and CEO of Jela Development Initiatives, where she does a lot of projects from WASH, as water, sanitation and hygiene, to voluntary blood donations, mental health support services. She does a whole lot in her organization, and she'll be speaking on the power of talk and empathy in addressing mental health challenges. And before she starts, I would love her to answer the following in her conversation. How can friends and family members better support their loved ones by using the power of talk and empathy when dealing with mental health challenges? How open and empathetic communication contributes to reducing stigma associated with mental health challenges? And how does effective communication and empathy between mental health professionals and patients lead to better treatment outcomes? And also, I want her to discuss how empathy, in what ways can workplaces, our working environments, promote conversations about mental health and cultivate empathy among employees to enhance overall well-being? I hope I was not asking so many questions.
Okay, yeah, I think you probably are, because it would have been great to have you send all of that so I can, put that within my breakdown. But let's see how I'll be able to respond to those questions, because I really couldn't hear everything, probably because of the network.
Okay, can you hear me now?
Yes, I can hear you.
Can you hear me now? Okay, yes. So the main question I actually want you to ask is, in what ways can workplaces promote conversations about mental health and cultivate empathy among employees to enhance overall well-being at the workplace?
Okay, so thank you very much, Imaga, for the
thank you so much.
Or also bringing me on board. I sincerely appreciate you, and also AYGF for this opportunity. I can see quite a number of us here as well. I'm really hoping that we are enjoying what is happening right now. And of course, to our previous speaker, thank you so much for the breakdown that you have given regarding mental illnesses. So first of all, let me say that I am not a mental health professional, in the sense that I am not a psychologist, I am not a psychiatrist, I am not a therapist, right? I am a mental health advocate. I am a mental health advocate because part of what we do in JDI equally touches a lot on mental health. I have a background in law. I also have a background as well in media broadcasting, and running the nonprofit JDI that equally has to do with mental health and advocating for these causes. So when Imaga reached out to me to say that, oh yeah, we're going to be doing this, and I really was looking out for the angle, right, to really take this conversation so it is more humanized. I think that a lot of times when we talk about mental health, it seems so far-fetched. Some people are are like, wait, what are we even talking about? And I try to make it as real as possible, as down to earth, as it is, and to show that it's really closer to us than we see it as. So my topic today is the power of talk and empathy in addressing mental health challenges. So when I was in WeFM 106.3. I used to be a broadcaster on WeFM 106.3. I had two shows, which is called The Conversation, and I had another one called Jela's Clinic. Now, our slogan in WeFM was called The Power of Talk. And each time we had that, when we said the power of talk, it was, even speaking about it right now, I can feel the power of that same talk. And we had this theme, which was, the more we talk, the more we gain common grounds. The more we talk, the more we gain common grounds. So what do we really mean by the power of talk? I can see Tachi here, I can see Wilson looking at me, I can also see Ibiene. And the fact that I can see three of you, but Ibiene or Wilson has not spoken or has not said anything, right? I really can't imagine what they're both going through, right? I can only just assume. I can say, well, from the body language, from how she's looking, well, maybe she's happy, maybe she's sad. I can say all sorts of things and make assumptions. But until Rita or until Emmanuel, right? I think I can see Emmanuel Ikaraku, right? Until Emmanuel opens up and speaks or says something, right? I would not know what exactly Emmanuel is going through. So there is a part of the courage to be able to speak and the courage to be able to what? Talk and say, this is where I am. So let's hold that thought on one side. Now in JDI, we organize what we call the Unburdening Group Therapy Session under our mental health arm. What we do is that we create a safe space for people to come into that space and they have access to a mental health expert. But interestingly, what we have done is that we try our very best to taper down on people or experts, just talking back at you and giving you all the advice and telling you this is what you should do, this is what you should do. But instead, we focus on giving people the safe space for them to speak and for them to talk. Because when they unburden and really speak about the different issues that they're going through, right? Then the more we talk, the more what? We gain common grounds. The more somebody else who is listening within that safe space can also say, wow, do you know what? I'm going through the same thing as well. I'm really not as alone or as isolated as I thought. There's some connection. There are some similarities. It might not be similar in relation to me and you, but it might be similar in relation to you and my sister. You or any other member of my community that I'm a part of. Monica or Rita or Ibiene decided to what? Talk. In talk. So let's put that on the other hand. Now, within our group therapy sessions, people are deep issues and you get to hear different kinds of stories. We are all made up of what? There is a story in you, several thousands of stories. If we want to take from when you were 1 year old to 5 to 10 and to where you are right now, you are full of what? Stories. And hear people talk and share and unburden about different kinds of stories that have eventually affected their what? Mental health. Or they may not even know that it's affecting their mental health. But in speaking about it within this safe space where we now have the mental health expert is now able to make certain, directions and, give some advice and everything. But the focus mainly in our group therapy session. And I have been so amazed. We have cried. We have become angry, connected. We have heard of all sorts of things simply because we have been in that space where people had the courage to unburden and to talk. Now, I just did a breakdown of really when we talk about mental health challenges, there is the aspect of mental health challenges. There's the illnesses part. And I think a lot of times we spend so much talking about the illness that might be so complicated. And then people are like, oh, that's really not where I am. But I realized something, that because we're so full of stories, that we see that most of the stories and the issues causing us anxiety, causing one party to be depressed, and all of those things are either in relation to relationships, in relation to financial challenges, in relation to health issues, in relation to maybe, some discrimination of some sort or some traumatic experience. And in all of this are what stories that people are now able to share. And then you find out that, wow, or maybe some really horrible words spoken to someone, that it got them to start to behave in a certain way, or it got them to start to relate to other people in a certain way, to the point that it started to affect their mental health. Because if you take that particular thing, let's say we take it from anxiety, or we take it from depression, and try to find our way back, we see that it is linked to either some financial issue, some traumatic experience, some relationship, something of that nature. Now, let me go back to our theme for this month, and we're talking about Suicide Prevention Month. I was having a conversation with my team members this morning, and I said, when a person commits suicide, the person is already dead. So the person committed suicide, the person is dead. If this person leaves a suicide note, we will get to see or hear of why the person took their lives. But if this person did not leave a suicide note, you and I, when we hear of the story, we will start to second guess. We will start to say, oh, wow, what happened to this person? Why did this person take their life? But I saw her yesterday. She seemed like she was all smiling. She seemed like she was all great. Actually, she didn't seem that way. She seemed very sad. There were certain changes that I noticed in her. She wasn't always like this, but everyone now starts to bring different issues that they noticed or things that they assumed about the individual, because everyone is trying to figure out what happened to this individual that this person took their life. Now, nobody commits suicide just like that. It doesn't just happen, in my opinion. I could be wrong, and I've not seen any statistics or anything like that that shows that someone just wakes up and says, you know what, I'm going to take my life, and that's it. I do realize that, yes, I will still stick with that. I don't think it just happens like that. There are certain things that have happened over a period of time. Thoughts of suicidal thoughts would have been coming up. Why would this person be thinking of suicidal thoughts again? It goes back again to different stories. It goes back to different experiences that may have happened to this individual, right? To the point that maybe they were not able to speak, or to talk, because it is only when you are able to speak out that others can help you. Now, again, when you say others can help you, this now leads me to the other part about the power of empathy. Because there's the power of talk for the individual that needs to speak, and then there's the power of empathy as well. And so what do we really mean by empathy? You know, I belong to an organization, or should I say I'm one of the Narrative 4 facilitators. Now, Narrative 4 is an organization that basically has a mission of envisioning a world where young adults are able to lead from the point of empathy, and also harnessing the power of story exchange so that they are able to equip their community and also able to improve their community. Now, in Narrative 4, we talk a lot about story exchange. And we know that stories help to break down barriers. You are able to share a part of your story that you are comfortable in sharing with me. I listen and I'm able to connect. And I'm saying, wow, this happened to you. This also happened to me. It's a way when we share stories, we also see things from a different perspective. So I wanted to hit on the aspect of empathy as to what it is. What is empathy? Because I feel like we tend to compare empathy sometimes with pity or with compassion, right? No, let me use pity, with pity. And if I were to open up and just ask each and every one of us, like, you know, what's your view of empathy? We would hear different kinds of definition as to what empathy is. And some could be right in the sense that it could be closer to the aspect of what really empathy is. And others could be, you know, way far away. But when we talk about empathy, we tend to look at it as empathy having 4 major elements. It has 4 major elements. And I would like to just quickly share what these 4 elements are. Empathy is when, number 1, you are able to see another person, right? To see their world. You see their hopes. You see their dreams, and you see their challenges. You have to be able to see it. That's the first thing. So I'm sitting down right now with Ernest Iyagi, and Ernest is sharing a part of his story with me. How does Ernest, or how does the third party, or how do I know that I am functioning in empathy? First of all, am I able to see Ernest's world in the story he's sharing? Can I see his world? Can I see his hopes? Can I see his dreams? Can I see his challenges? First, the second element of empathy is, after seeing all of this, am I able to appreciate Ernest as a human being? That Ernest is a human being. And in this, I am not judging him. Remember, Ernest shared his story with me. I'm able to see his world. I'm able to see his hopes, his dreams, his challenges within what he shared to me. Then I move on to looking at Ernest, that he is a human being like me, blood flowing through his veins. Ernest is a human being like me, and I am not going to judge him. The third part of empathy, right, is now Ernest has shared that story and I see him as a human being and I'm not judging him, and I understand You see, this is the part of empathy where sometimes people say walking in other people's shoes is you understand it. Because when we look at the definition of empathy, right, there's a part of empathy that is feeling in and feeling with. If you can see my hands, there's the in, there's the with part, right? So now the third element, which I mentioned, is understanding Ernest's feelings. Because what? Ernest is a human being and I'm not going to judge him. And then the fourth part of the fourth element of empathy is now, because I feelings, I'm able to communicate the understanding of that feeling. Now, this communication is the with part. The feeling in, right? So those are like the four. Empathy is feeling in and with people. But what I want to also show you what empathy is not. So that we can push it together. Empathy is not you saying, yeah, okay, oh, yeah. And what is happening to you is also happening to me. Me too now. What's the big deal? That is not empathy, right? Then empathy is not also you having to like that individual. I think that some people feel like, for me to have empathy for another individual, I must like you. I don't need to like you to empathize with, right? And then the third part is, I also do not need to agree with your perspective. To listen, understand your story, see your world, because everyone has different stories. We're all a bundle of stories. Now, you share a particular thing with me, I'm able to see it. And I'm able to understand that you are a human being and I will not judge you in that situation. And I'm able to understand what you probably went through in that situation, and I can together. So that means that I do not need to agree with your perspective, right? And then the last part is that you do not need to leave that person's experience, because some people are always, they look at empathy as, oh, I must live in your own experience. Yes, there's a part of you when someone shares their story and you are, so for example, there's a part of our story exchange where there's a retelling part, and then the person who shares the story with you, you kind of like have to tell that person's story from your, as if it were you. So if for example, I was listening to Ife Oluwa's story, Ife Oluwa Prince shares this particular story with me within our story exchange, and he shares this or she shares that, right? And I go and I want to retell that story. I would retell it as if it were me. Honestly, I am working in the aspect of what? Empathy. Now, chances are that if I listen to you and I'm functioning in the aspect of empathy with all of these four elements, right? Chances are that I'm going to be more compassionate. Chances are that whatever issues I feel that you are probably dealing with, that I can actually help. Because I'm functioning in empathy, I am more likely going to help you better. I may not know how to deal with that situation, but because I am functioning within empathy, I can say, I can't deal with this situation, but I know someone who can help you. Can you see that this is the action, right? This is the action. This is not the just staying in one spot and not doing anything. This is the action. Now, so when we talk about how do we create a community of people? And when I say a community of Nigerians, that's one. How do we create a community of work, of colleagues, a community of family members? Because we've got different kinds of community in such a way that they are so full of empathy through story exchange, right? That they are able. So now let me take this example of this individual that has now committed suicide. And this individual is dead. And everyone is finding out, oh, what happened, and all of that. So let's trace it back. A Moses commits suicide. But was there any time a Moses, right, was able to, for once, have the courage to speak to a Boniface Imo? To say, Boniface, do you know what's like, there's something happening to me, and the person just has that courage to talk. Instead of Boniface to listen from a point of empathy, Boniface is like, I beg, please, now only you. I beg, please deal with it, you are fine. Then Moses shuts. I'm not sure I want to share anything again because people around me don't really understand. And Moses starts to go through even more and more of the issues that he feels that he's dealing with. And there's nobody around to show empathy. There's nobody around to say, I see you. I actually see where you're coming from and I see what you are going through. And this is what I think we could do, about it. Then Moses shuts down and continues, and it becomes worse. Whatever that person is going through, it could be financial, it could be relationship, it could be a traumatic experience, it could be all sorts of things. It could be living even in a toxic environment and not able to talk, or even when they are able to talk, there is the right community around us are not those of empathetic individuals. So I was sharing with my colleagues that, for me, when I hear issues regarding, mental health and people are always talking about the government, or, what would the government do in relation to stopping suicide? Is that the day that person died, was it Tinubu, the president, that was there? No. Was it a hospital that they went to and then they decided to commit? No. So it is not so far-fetched that we're looking at. It is actually closer to us. These individuals are human beings that are around us. So How are we showing empathy that when people have the courage to talk and to share, we're able to listen, to say, do you know what? I see you and I hear you. And this is what we can do about it.
Thank you so much. I couldn't even stop you. We could go on and on the power of talk and empathy. And I know a lot of us have questions, but because we're working on a time schedule, we'll have to move on to the third speaker has joined the conversation. So I'll introduce Mr. Dennis. His name is Mr. Dennis Agbeti. He is a mental health counselor, a behavioral change therapist, a certified peak performance coach, performance management consultant, corporate trainer. He has background in education, experience and exposure in computer science, engineering, neuro-linguistic programming, cognitive behavioral therapy, and freedom technique, emotions and freedom technique, metrics, re-imprinting technique, and others. He helps organizations shape behavior and culture to enhance performance, multiply productivity and profitability. He achieves all these through psychotherapy sessions, coaching sessions, and consulting. He is a mental health counselor, specializes in helping people overcome and recover from depression, anxiety disorders, and traumas. He is the CEO at Reactivation Limited, a company that offers employee support programs, psychotherapy interventions, executive and team coaching, corporate training, and a lot of others. And he is also a mental health counselor with the Anti-Suicide and Depression Squad, ASAD. Mr. Dennis, we welcome you to the webinar. So welcome, Mr. Dennis. And Mr. Dennis will be discussing on the core theme of the program, discussing on suicide, how pregnancy and postpartum depression can lead to suicide, and the strategies needed to build awareness around suicide. Mr. Dennis, welcome to our webinar. It's great to have you here. You're welcome, sir.
Yeah,
and I want to give a brief background why we chose postpartum depression. So currently at Aygf, we have an ongoing program in 3 states, Kogi, Niger, and Katsina State, where we actually give 7 services to pregnant and lactating mothers, and also children under the age of 5. And one of the services we also give is counseling session, which also includes psychosocial support. So that's why I brought up the topic of postpartum depression and how it can lead to suicide. Being a mental health counselor and working with Anti-Suicide and Depression Squad, it's good to have you dissect the strategies needed around building awareness around suicide, pregnancy, and postpartum depression. Welcome, Mr. Dennis.
Thank you so much. Thank you for having me this afternoon. Thank you for the invitation. I was really enjoying the last speaker. I wish she wouldn't stop. She's so eloquent, and I love the way she says she humanized the subject. So I hope to write on her energy to also see how I can humanize the subject so that everyone can understand and it's relatable. We're talking about strategies needed to build awareness around suicide, and also how pregnancy and postpartum depression can lead to suicide. It's a very important topic. The level of suicide and the rate at which people are committing suicide right now is increasing. I was working with an hospital, one of the leading hospitals here in Abuja, government hospital, and I was speaking with the nurses, about 160 of them, and they were complaining about the number of people that they are rushing to the emergency ward. And the reason why they are rushing them is because of attempted suicide. And interestingly, just recently I was talking and they said the number of postpartum women and also postpartum men attempting suicide. People don't know that men also have postpartum depression, but there are men that have postpartum depression too. So it's really on the rise, and we need to start talking about this more. And I have a 9-month-old baby. So, and my wife just gave birth about 9 months ago, and I can relate a lot with the topic. All right. So, but today I want to drive into some of the things that can lead to depression, or can drive a postpartum woman to committing suicide. There are 5, based on my practice as a counselor. One of the things I've noticed, I'm going to mention 5 feelings or emotions that drive postpartum women to committing suicide. Now, it also relates to people who who just have the major depression, not postpartum women or postpartum men. One of the major feelings that drive people to want to commit suicide is the feeling of tiredness. As simple as tiredness is a serious driver, and tiredness drives people to committing suicide. When people are exhausted, and this happens to a lot of pregnant women. I remember when my wife was pregnant, almost every day the complaint was, I am tired. Like almost every day, right? Because of the carrying the baby place a lot of demands on their body, their mind, their emotions. hormonal imbalances, the pain, the discomfort, right? The changes in their body anatomy, those things just pull a lot of strength from them. And by the time they now even go to give birth, some of them have to push for hours, while some of them, after they push for hours, they have to take them through, they have to go under the knife. And it's a very scary experience, right? Very, very scary. I remember when my wife was going to the theater, she used to form strong woman, and I was always there. I was there because I said I was going to be there from the beginning to the end. I'm not going to leave out. So when we're talking about, when we say she's pregnant, we should say we are pregnant. Say, I'm carrying this thing with you. And when we were pregnant, I was so lean, because I was really, really engaged. And what I can say is that process is really, really tiring. And when people get exhausted like that over a period of 9 months, then they go through an intense traumatic experience of delivery, scary, painful. It's traumatic for some women, right? Or most women. It can pull from them that by the time they are done, they just feel tired. Like, what is life? Then their thoughts start playing on them, and before you know it, they want to commit. They're having suicidal ideation. So tiredness is a major thing that drives people or postpartum women to committing suicide. And what we can do is that that's why women who are pregnant and those who are postpartum, they need a lot of support, When that support is not there, they get easily tired. Number 2 is the feeling of helplessness. The first one is the feeling of tiredness. The second one is the feeling of helplessness. Once you get to that point, and even beyond just postpartum men and women or postpartum women, when anyone gets to that point where you feel completely helpless, that feeling, if it's sustained for too long, it can lead to someone contemplating suicide, right? When you feel like there's no way out, I'm stuck. And that feeling stays for too long. For most postpartum women, that feeling stays for more than 9 months, right? I mean, they are pregnant, they don't know how to help themselves, right? Sometimes they can't even work by the time the pregnancy, so they can't stand up themselves, and they experience that helplessness for a long time. Because the thing about emotions are not bad. It's okay to have emotions once in a while. You're going to feel fear, you're going to feel helpless, you're going to feel stuck, you're going to feel frustrated, resentment, and all those emotions. The problem is not that you are having those emotions for too long. The problem is the longer you hold on to an emotion. Well, this is my daughter's cup. Now, this cup is very, very light, very, very light. I can hold this cup but if I hold this cup for like 20 minutes nonstop, what happens to my hand? My hands begins to ache. If I keep holding up this cup up like this for the next 20 hours nonstop, my hand will begin to feel numb. Not because of this cup is so light, but the longer I hold this cup, the more heavier this cup becomes, the more painful it becomes. If I keep holding this cup for 2 days nonstop, this hand is gone. This hand is paralyzed. And that's what happens when people hold on to emotions for too long, right? The longer you hold on to an emotion, the more painful the emotion becomes. The more heavy the emotions become, the more the emotion begins to harm you, right? The more it begins to make you feel numb. The pain becomes unbearable. And once people begin to feel like this emotional pain is so unbearable for me, they begin to contemplate ending it all. Because most of the times, that feeling of wanting to end it all, they're trying to run away from an unwanted emotion, right? So the feeling of helplessness is the major one. And one of the things we encourage for everyone is that for you not to sustain the feeling of helplessness for too long, it is important that at every point in time, we focus on what we can control. Anytime you keep focusing and worrying about the things you cannot control, you are going to feel helpless. You are going to feel out of control. Now, the problem is the longer you feel helpless, the more dangerous it becomes. You begin to have cognitive distortions. Your thoughts begin to have thoughts you're not meant to sustain. And before you know it, now you're already contemplating ending it all. So always learn, even for postpartum women, there are a lot of things you may not be able to control as a postpartum woman. A lot of things you may not be able to control. Always take your attention away from what you cannot control and ask yourself, what can I control? What can you control? You can control you can control your self-talk. You can control your reaction to the pressure and the stressors of just giving birth. You can control your thoughts, what you're telling yourself, your reaction and your responses, because those things are the things that you actually amplify, right? Because many of the challenges you are going to face as a postpartum woman, those things, we call them stressors. It is how you are interpreting and reacting to those stressors that will determine how you're going to feel in the long run. The third feeling is the feeling of the lack of love. Lack of love. What drives postpartum women or pregnant women to want to commit suicide? When a postpartum woman or a pregnant woman feels like no one cares. Once they begin to feel, I'm alone in this. Once they begin to have neglect, and it happens in a lot of homes. That's why a lot of women have resentment towards their husband, right? She went through the pregnancy, you were not there. You didn't give her attention. You didn't provide the emotional support, because a lot of men, and that's why I've been speaking up to men recently. If you go on my social media page, I've been speaking up to men. And a lot of men, especially in Nigeria, what I observe is that men just think that, okay, if I just provide money, then I'm okay, I've done my job. And they forget that women, and pregnant women for that matter, and postpartum women, they need more than just financial provision, right? They need more. They need emotional security. They need reassurance. They need your emotional support. They need your presence. They need your support. They need you to serve them. So when these postpartum women or pregnant women they feel neglected for a long time, and they feel they can't feel that love, they can't feel acceptance. There are women that are going through, because they are lonely. They were lonely all through their pregnant period. I remember those days when my wife was when we were pregnant, right? If I go out, because I had to stop all my operations and just work from home that period, because I was living in Abuja, and our family members were not in Nigeria, we're not in Abuja. So I had the sole responsibility to take care of her. So I had to work from home. But if I say I want to just go out, okay, babe, I have work to do. I need to go and speak at an organization. I'll be back in 2 hours. Once I go and come back, my wife is on the floor crying, throwing up, feeling sick. I can now imagine the women that actually go through pregnancy alone. If I could just leave my house with my wife for about 2 hours and I come back and she has shown up everywhere. Tomorrow I go for like 5 hours, I come back and she has shown up everywhere. She's crying. She has even fallen sick or something. I have to start taking her to the hospital. I can imagine a woman that went through pregnancy almost all alone, with no support, with no support from the husband or support from the family. So the feeling of lack of love can really trigger and drive a postpartum woman or a pregnant woman to committing suicide. The other feeling, all right, so apart from the fact that the person doesn't get love from the outside, there's also the issue of self-love. So a lot of women don't, or pregnant women or postpartum women, all their attention of love is going to the baby, right? And many a time they themselves neglect themselves. They stop paying attention to their own care. And that can go a long way in affecting them, right? So they may get neglect from people outside. They themselves sometimes neglect themselves. Sometimes many of the pregnant women don't even forgive themselves. I've spoken to a woman who went through CS and she started blaming herself that she's not woman enough for going through CS. She said that, I couldn't give birth to the baby myself. I needed to go under the knife. And that was the reason why she hated herself. She was resentful towards herself. She didn't forgive herself. And that kind of thing can exhaust such a person. And before you know, the person is already contemplating suicide, right? So it's important that as a postpartum woman or a pregnant woman, you practice a lot of self-love, right? And when it comes to self-love, the foundation of self-love is unconditional acceptance. It's not even before you start even taking care of yourself, you must always learn to accept yourself. Yeah, there's your body, there are changes going on in your body, there are changes going on in your feelings, there are changes going on everywhere inside and outside of you. You must never, right? You don't have to earn your love. You don't have to earn your own self, your own forgiveness. You offer yourself love, offer yourself self-forgiveness unconditionally. And that is very, very important. And for people around a postpartum woman or a pregnant woman, they deserve unconditional acceptance. As a husband of a postpartum woman, as a husband of a pregnant woman, your wife does not have to deserve your love. It is a taboo to expect your wife to deserve your love, to earn your love. And that's what all Nigerian women are dealing with. Men that think that, okay, your wife is pregnant, your wife, I've had to attend to couples that okay, the man have resentment towards the wife because when they gave birth to the child, the wife's attention was to the baby, and the wife didn't have enough time for the husband again. And the husband became angry because of that. Seriously angry. And that was what led him to start cheating, hurting the woman more. And when you say, why? You see, the attention was just to the baby. Where do you want the attention to be before? So it's important that we deal with this. So as husbands, we want to beg you, your wife needs unconditional care, unconditional acceptance. I'm very, very emphatic about this issue. Emphasis on what? Unconditional. There are times when she will not be able to play the wife duty. You should know then that you are supposed to stand up to help her. All right? Can you hear me? If you can hear me, let me know. Okay, you can hear me. Okay, so I was talking about the feeling of tiredness, the feeling of helplessness, the feeling of lack of love. Another major feeling that drives postpartum women and pregnant women to start considering suicide is the feeling of hopelessness. Interesting, right? Especially postpartum depression, postpartum women. I've had to speak to a number of them, and you'll find the level of hopelessness in them. And this is not far-fetched. This is what happens psychologically, right? Hopelessness is a very serious issue, and that's one of the symptoms of depression, right? So you see, there's a study that happened when they were studying or doing a research around astronauts. And they found out that most astronauts who have gone to space, who have landed on the moon, some of them commit suicide, or some of them landed with serious mental health issues, like depression. And when they studied into this, they found out that what happened was this. Many of the astronauts, they had this hope and goal or life dream of going to space. That was the only dream they have. That was the only hope they had. That's all they focused on. That was they dreamt about it. They worked towards it. They sacrificed for it. And that's all they wanted all their life. Now you had the opportunity to go to space, to climb, to step on the moon. And that was that all. Now their life dream has been accomplished. Now they come back from that experience and there's nothing else to look forward to. Because for the past 20 or so years, all they look forward to was one day I'm going to go into space. Now you've achieved all you wanted. Now you just feel completely hopeless. Nothing to look forward to again. And it happens to pregnant women. For 9 months, or even before 9 months, you wanted to have this baby. You were so happy. This baby. When you were pregnant, you were rubbing, oh, this baby. So people, even before they get pregnant, they start praying for babies. So now you give birth to the baby you've always hoped for. The baby is now in your hands. After some weeks or some days, there's nothing else to hope for. Apart from that, the baby came with so much pain. I've had to work with women that ate their babies, ate their daughters. And you can't blame them. By the time you listen to you can't blame them. You can't blame them. And that's why what we encourage postpartum women and pregnant women, yes, you look forward to having a baby. However, it's important that you create hopes everywhere. Have goals for different areas of your life. Apart from family, have goals for different areas, health goals, family goals, career goals, financial goals. So that when you give birth to that baby, there's still more to look forward to.
Yes.
You don't set up yourself for depression. Okay, I know my time is up. The last one I'll talk about is the feeling of meaninglessness. once you get to a point like, what is this? What's all this for? What's the meaning of life? What's the essence of my life? What's even the essence? You see the questions postpartum women ask themselves. Okay, I'm giving birth now. What else? Lack of meaning, lack of purpose. And sometimes the issue is not even lack of purpose. The issue is that when you've not mastered the act of choosing your own interpretation to life, and you just allow life to give you its own interpretation, because nothing has meaning except the meaning you give to it. I'll say that again. Nothing has meaning except the meaning you give to it. If you don't know how to give the proper meaning to your life, proper meaning to what you are going through, the pain you are going through, and you are misinterpreting the pain you are going through, if that sustains for a long time, you might be setting up yourself for depression and suicide. All right, finally, I'll talk about the strategies that we need to build awareness around suicide, right? Like what my friend, my boss, I'll call her my boss now, she spoke before me. She mentioned that we focus a lot on the government organizations. Well, I agree, right? However, if we're going to go our strategy, the government play a serious role. And we're talking about, we need to talk about the government institutions, the non-governmental institutions, the private organizations, religious bodies, then we'll go back to family. So from the top, the government institutions, we go to non-government institutions, private organizations, religious bodies, before we now talk about the family, what we are doing in the family level. So we need to spread the news within family. We need to talk in terms of family, then we'll talk about individual, peer-to-peer, right? So when you gain the awareness, you need to talk to people around you about it. Take responsibility for the people around you. We say that you are as healthy as the least healthy person around you. You are as healthy as the least person around you. So if you say, I don't care, me, I just want to be fine. I don't care. Energy is contagious. And that's why we need to take responsibility for each other. You need to be your brothers and your sisters' keeper, right? And like she mentioned, empathy, very powerful. Very powerful. I love the way she broke it down, that all of us can understand, right? So I think I'll just stop here for now because of time. Thank you so much. I hope you got value.
Thank you so much. Thank you so much. I could relate virtually with everything. The panelists have been so amazing, and we'll have a short period of question and answers. We'll be taking just 3 questions from the guests. But before then, I want to have a quick run for those that joined late. Thank you so much, Ms. Faith Osemeke. She started with mental health and the issues around mental health in Nigeria. She emphasized the fact that before you say you're mentally fit, you have to be sound all around. So from your emotions to your physical health to your psychological health, your biological health, you have to be sound. That's the only time you say you're mentally fit. She also emphasized that we should know that people go through traumatic experiences in life, and that some people come out stronger than others. Others become psychologically or physically traumatized. And also, she also said that before you can be diagnosed for depression, you must meet the DSM-5 of depression. Those are probably medical terms, I don't know. You must meet all the 5 requirements of the signs of depression before you are declared depressed. And she also said that we should always remember that we have control over how we control our irrational thoughts. That we should be able to control our irrational thoughts to affect us positively. And also she said we should always look out for warning signs. As she said, we should avoid extreme anger, extreme violence, extreme anxiety. So whenever we are anxious, we should be able to reduce our anxiety, work on our anger and all. She actually said a whole lot. She went on to mention the various types of disorders. She also went on to answer a question on mental health and how it's connected with physical health. And Mrs. Angela spoke so much on the power of talk and empathy. She said that our stories make up of all that we are. We have stories. I actually personally have so much stories, from age 1, age 5. I could remember from age 5 to 10, I have stories, 10 to 15, different stages of my life, I have stories, and I'm sure everyone has stories. She said we should always relate to people from the point of empathy. So empathy is not just a yeah, like she said, a yeah, no, it's not just that. It comes from you feeling in. I like what she said, feeling in and feeling with. A lot of Nigerians, most times when you lose a loved one, irrespective of closeness with the person, if it was your mother, your father, or a friend, just say, it's time to move on, but most times, the feeling is not, you can't just move on. It's not easy to just move on. You need somebody to empathize with you, So when she spoke about the power of empathy and how we could indulge in empathy, even from our colleagues in the office to our peers and people around us, our community, building an empathetic society. She emphasized on that and how they do a lot of work at JDI with the onboarding therapy session. Thank you so much, Mrs. Angela. Thank you so much, Mr. Dennis. Mr. Dennis spoke, he said a lot. I'm a mother of two, and I know what it means to actually feel tired, especially after pregnancy. You feel you've lost purpose, especially that period where you're nursing, that 3 months post after pregnancy, you feel like I can't even connect with the world. Your clothes don't fit. You start feeling as if you don't fit into the society. I like the fact that he spoke on how we could control that by showing ourselves love first and being in a community where a lot of people love us. Thank you so much, Mr. Dennis. Thank you so much, Mrs. Angela. Thank you, Miss Faith. We're so glad to have you on this webinar. And let's take our questions. We have hands raised, Mr. Clement. So please, you unmute yourself and ask your questions. Brief questions, please. Thank you. Mr. Clement. Mr. Ernest, you can unmute yourself. Your hands is raised.
I don't know. Yeah, can you hear me now?
Yes, we can hear you.
So first off, thank all the speakers for everything they spoke on. I've learned a lot, particularly Ozioma. I remember when she said passing through trauma doesn't necessarily mean the person is traumatized. So that was actually something to really sink in. So now a question to that is, what are these particular indicators from that manual you spoke about that one can really see and say, okay, this person is depressed? Because in Nigeria, we use this word depressed a lot. Like you hear
I guess we have network issues messing up with that. But if you can type the questions in the comment section,
so
I'll
what
be able
are
to
these
read it
particular
out.
indicators or signs that you must tick before saying somebody is depressed?
Okay, thank you so much for the question, Mr. Ernest. Can we hear me, please?
Yeah, we can hear you. We can hear you.
Okay, so it's okay. I'll mention a couple of symptoms, but I like to say the reason why, what you can see before. So, like I was saying earlier, you cannot self-diagnose. However, you can see symptoms that can point you to going to see a health practitioner or a health professional. Those symptoms include extreme tiredness, like Mr. Dennis said, feeling of hopelessness. You find out that you now have apathy, you lack interest in things you normally do. For instance, you are someone who likes to put yourself in order, like look smart, look good. You like to cut your hair, look very tidy. And all of a sudden, you no longer have interest in looking tidy. You don't care if you don't take your bath for 3 days. Eating disorder as well. Maybe the way you eat before, if you eat normally, now lack of interest again, not eating well, not sleeping well. So these are symptoms. When these symptoms persist, then for a long time, now affecting the quality of your life, affecting your functioning at work. You find that even to write a report, or you're now very tired and slow, supposed to report it. Normally you'd have reported, your reports and sent in your reports in like 3 days, but now it's a week, you haven't done it. It's now a pointer for you to go to a health professional for evaluation. Because when you meet the health professional, apart from the fact that they are looking at the symptoms that they can see now in your life, they are also going to look at triggers around you causing this depression. They are going to talk with, if as the case may be, when they feel it's severe or profound, then they begin to say, okay, they have to talk to your family members and find out. So we're saying that it's only the health practitioners that can diagnose you with depression. But then these signs I've mentioned are signs or symptoms of depression. I don't know if I answered the question.
All right, thank you. Thank you so much.
You're welcome.
So Mr. Ennis has his hands raised. So Mr. Ennis, I don't know if you can unmute yourself and turn on your mic.
All right. Thank you, Angela. Thank you, Dennis and Ozioma. We're aware that depression and mental health is becoming a global crisis. Then you took us through the area of advocacy and helping to create awareness about this issue. Then particularly to Angela, you also mentioned the area of helping to probably mitigate against some of these issues. So my question is this: do you see education and public awareness as probably a straight mitigant to helping to reach out to these people who are probably vulnerable, pregnant women and new mothers, very inclusive?
So is that question to me? Okay.
Angela.
Okay.
Angela.
Okay.
Okay, who is Mr. Dennis responding to that? Oh, I didn't.
We're waiting for you to respond to that, Ms.
What do you mean?
Angela.
Right,
Ms. Angela.
I mean,
Yes, it's directed to you.
I mean, the aspect of, yeah, I mean, that's a clear-cut answer, which is yes. To respond to that, I think I'm just trying to give a typical example. So in one of our projects that we're working on right now in JDI, it's a mental health project, but we're working with public secondary school teachers that are also dealing with, of course, the Gen Zs. Now, part of what we have to do is how do we educate teachers about mental health in the first place, their own mental health and the mental health of the students that they're teaching? Because if they don't even understand this in the first place, then the way they are going to communicate the curriculum or whatever, they're just not going to function, properly. So I use this example to say, yes, education is very critical. So let's go to pregnant women. How is it possible that when women are going for their antenatal as well, that these are the things that they're educated, about during antenatal? I'm just thinking about it right now. I mean, I have 2 children. One is 13, the other is 10. For my 2 antenatals that I went for, I'm not sure anybody told me anything about postpartum depression, about things that could happen, to me. I'm not sure all of that kind of education was given to me. So probably maybe based on what I read or what someone said, if mother-in-law or whatever mentioned all of these things. So education does play a role. How can we ensure that in every form of structured education or system, in everywhere, we can just put that information regarding mental health? And that's what we've been doing a lot, in JDI. How can we make
mental health as a conversation so basic and so plain, that everyone doesn't, really think is so far-fetched. It's really closer to us. And once we know how close these things are, then we're able to be more supportive to the community that we are in, and also a bit more, of course, empathetic to the individuals that we're around. We talked a lot about postpartum women. You can also look at people with disabilities, look at different categories of disabilities as well. We've been working with those with disabilities, and we see how different issues are affecting them. And even within their education, there's educational structure and their systems. So what we also did as well was, how can we educate those students without disability to also know more about the mental health challenges as well that people with disabilities are going through. So I think education, awareness, we just have to keep pushing it there continuously. It does play a role in responding to these issues.
Thank you. Thank you so much. I hope your question was answered, Mr. Ernest Eyaji. So we have the last question, Miss Claudia. Miss Claudia, can you unmute yourself and ask your question? Hello, Miss Claudia.
Yeah, can you hear me?
Yeah, I can hear you clearly.
Hi, everyone. Thank you so much
Hello.
for this insightful webinar. I think my question is directed to the second speaker. She talked about empathy and communication, or basically being able to talk. And I think from my observation, there is a thin line between showing empathy to people going through challenges and then taking it upon yourself, the burden and the pressure of trying to fix them or see that they are, well. So like, where do you, or how do you draw the line with showing empathy and, unnecessarily burdening yourself with something you may not be able to handle or control?
Okay, so there was a term you used. You said maybe carrying the burden to fix them. Empathy is not about fixing the individual. Remember, I said it's feeling in and feeling with. The truth of the matter is the fact that if I tell you the power of listening alone, just being there to listen to someone speak can be the difference between that individual taking their lives, just listening without even you saying a thing. So I think as well that we tend to feel like, oh, we have to be the savior to save that person. It's not necessarily. We're saying, can you function with those 4 elements that I gave an example? Can you actually listen to me when I speak? And you're not judging me. You see me as the human you probably are going through, but maybe in a different way. And you're able to feel with me. Just feel with me so that I can actually say that, wow, this lady actually understands where I'm going, what I'm going through. Or this man understands what I'm going through. And this person may not even need to say one thing. And you literally just feel like, wow, I got listened to and I got heard. You didn't fix me. So I think that's what people are scared of. I think people are scared of the fact that, I don't want to hear anything, because if I hear right now, then I have to help you. I feel like when we're trying to function in empathy, it's a very vulnerable state, because actually it's a vulnerable thing for both parties. One party person judge me, am I safe? And the other party too is also saying, if I hear this now, what would I be able to do? So let me give an example. Today, info, we're talking about the Jacques syndrome and why people are leaving.
Hello, can you hear me? Hello? Hello? I feel we have some network issues
Yes,
and
we
we've
can hear
lost
you.
okay, we've lost
Can
Mrs.
hear you.
Angela. Okay, we've lost Mrs. Angela, and we still have 2 hands raised, but okay, we'll take one last question. Please make it snappy, and because we have to round up in less than 10 minutes. So Miss Esther Adaji, please, can you unmute yourself and ask your question? That's the last question for the session today. Thank you. Hello.
Happened. I honestly don't know what happened. My system went off, so I had to reconnect on my phone. Off.
So my question is directed to Mr. Dennis.
All right.
I would like to know how the work environment will help mostly the
Can you come back? Can you? I didn't get that question. Did you get the question? Oh, she has gone off.
Okay, so hello, can you hear me? Hello,
Yes,
can
we
you
can
hear
hear
me? So I think if I took note of a question. She said, how can we help postpartum fathers if they are, for instance, going through depression? How do you help them as their friends or colleagues in the office? How do you show support to postpartum fathers? Because everywhere is mothers, you know. How do you support postpartum fathers?
Okay,
Friends and
okay.
colleagues.
So I think that Angela's said how we can support them. That empathy. So a lot of men are not. I start with the boy child, right? They're not used to being listened to, and men are not allowed. When I say, I don't know who did not allow the men, but there's a way the boy child has been programmed not to express emotions, not to. They feel like be a man, you know, that kind of mantra that they tell men. Men don't cry and likes. So I think that men need to begin to need to learn how to be vulnerable, and they need to learn how to allow themselves speak up, because sometimes you can't help people that are not willing. Right, I've had to work with a lot of men, and you see that the way they are locked up, they are not programmed to get help. So, like what Angela has been saying, we need to be more empathetic. Be available to listen to them. That's for those who will be willing to open up, because many, from what I've seen and experienced, find it difficult. They are not used to being listened to. So empathy is very, very important. And you encourage them to see a mental health professional, right? Sometimes as a wife, you have to go with them and encourage them that there is nothing wrong in not feeling okay. It's okay not to feel okay, right? As a man, it's okay not to feel okay. And you don't have to lock things up and isolate yourself because of your feeling a certain way. So we encourage men to get help, see a mental health professional when they are dealing with stuff. And for those who don't want to, then I think that
Hello, I guess we lost Mr. Dennis. So please, Adeshaya, please unmute yourself. That's the last question, please. Unmute yourself and ask your question quickly, please. Last question.
Hello, can you hear me?
Yes, we can hear you. I can hear you.
Okay, thank you so much for the opportunity to ask the question. I was almost typing it on the chat box. Okay,
Okay.
I wanted to ask, yes, it's towards empathy. I've noticed that a lot of persons that are quite in a depressive state, it is sometimes difficult to know. So I just want to ask, what are the trigger questions that helps you to know? Because some persons would not really want to share with you what is going on with them, what is wrong with them and all. But there's some certain way, and although the attitude is there, but there's some certain question you get to ask this person. And that question is like something that opens that person up and say, oh, this thing is happening. I have to be honest. So that's my question.
Okay. Since you mentioned empathy, so let me say something. I really need to hit on the part of the fact that a lot of us do not understand that there's a skill in relation to listening. There is a way, and there's a way I can show you that I am available for you to speak with me at any point in time. I don't think there is a particular question. Maybe our Ozioma would be able to say something here, but for me, I don't think there's this, magic question that once you ask that question, the person just opens up and starts to speak. People need to know that if they're vulnerable with you, that you are a safe space for them to speak. So you as the individual must be able to, at some point in time, I'm here. I'm going to listen to you. If you want to talk, I'm here to listen to you. No judgment, nothing. If you want to talk, share with me. And then when this person starts to speak with you, are you taking your phone and typing and doing something else and saying, oh, because the moment you start to do that, I'm like, no, this person is not even willing to listen to me, or is not watching me properly and actually understanding the fact that I'm about to share something that is so critical and I need your full attention. And so listening allows me to be so focused on you. I'm giving eye contact to you as you're speaking. My facial expression and everything that I'm doing shows that I am with you and you are speaking. Now, you might start, first of all, by sharing something, and then you're watching me to see how I'm going about the listening. And if I'm able to show that, yes, I am with you, that allows me to also open up further to say, maybe I can go a step further. In the aspect of empathy, both parties, it's a vulnerable state that you are both at, because you are thinking, oh my God, what if you share something with me and I'm not able to do anything about it? And the other person say, what if I share something with this person and they're going to judge me? So both of you are in a very dicey situation. But once stories are being shared, you're listening properly, the other person is feeling more safe with you, I'm telling you, barriers are going to be broken down. And you now see that even it is impossible for me to know, right, that you are about to commit suicide. And I would say, yeah, if I was really listening, it's impossible. If I really see you as a human being, it's impossible for me. I can't let you go in that situation. I would do something, even if I don't know what to do. Suddenly, I'm now thinking, oh my gosh, I need to call this person. I spoke with this lady, blah, blah, blah. How can I get help? How can this help? Why? Because I have positioned myself, right, in such a way that this individual is able to share with me the deep things that they are going through. Right. So I don't think there's one that I know that there are certain tools that, and I think Ozioma can also share, in that. I know that there's certain tools that are used, different questions that are basically asked. And when people respond to the question, that's like measured, then you get to see, okay, this person is closer towards you have all of that, but you might not have that. But every individual has the ability to sit down and actually listen to the spheres, the people around you. And when I say people around me, I'm a boss. I've got colleagues. I've got staff members. Do my team members know that I'm here to listen to them no matter what? So these are the things that I feel. So for me as an individual, we're trying to see how can we encourage more of story exchanges within different communities so that people really understand how to function in
in being an empathetic individual. Because even that same father who is going through postpartum, you know, as a father as well, he can imagine that one of the issues he might be having is, how do I raise this particular amount of money to support my wife? And that's the issue. But he gets to speak out, he gets to talk, and someone is able to support him to say, this is how you could go about it. I can help you in this area. This is the power of talk. If you are not able to talk, right, people can't help you. And again, if you are not empathetic to allow people to speak, then you can't also help another individual.
Absolutely.
Because I think.
Okay, so can I share with others?
Yes, you can, but you have 2 minutes.
Fast, okay.
So
I'd like to say 2 things. First off is, most times people that have postpartum depression Okay, can we hear me, please?
I can hear you. I can hear you.
People that have postpartum depression most times are people that might have been depressed before pregnancy. So when they've been depressed, like the first person that asked the question was saying how education can help with help alleviate postpartum depression. Because if you have been depressed before, you know that you have more chances of having postpartum depression if you're pregnant, and then you go for tools. They can put tools in your hands. So for the question that was asked, are there questions that can help you handle people with depression? There is a therapy known as cognitive behavioral therapy. What this therapy does is to look for the core belief responsible for that misbehavior, that depression. There is an art to it. Then they ask questions, get to the roots, that core belief responsible for the depression, and change it by asking questions like why. Because that core belief responsible for that, for you feeling tired and hopeless and wanting to commit suicide, by the time they ask you, systematically ask you questions, using the why, not asking, like she was saying, judgmental questions, okay, then they can now change the irrational thought to irrational thought. At the point where they are able to get the core belief responsible and change it, guess what? Your emotions change. So cognitive behavioral therapy is a tool that can change your emotion from tiredness to being indifferent or to being happy by changing the thoughts responsible for it. So yes, there is a system to it, and that's why there are health practitioners that have been equipped with it. She was talking about listening, very good tool. You have to listen, the ability to listen, talking therapy. Beyond talking therapy now, trying to help get rid of the irrational thoughts is the cognitive behavioral therapy, mindfulness, and other tools that can be very helpful. Yeah, so
thank you so much, Ozioma. Thank you so much. And before we end our webinar, I want to leave us on a high note. I want us to forget about this mental health issues, because some people are already thinking, and people are already thinking, am I depressed? Am I likely to have mental issues? They're trying to diagnose themselves. But I want us to live on a high note. Now, and I'm throwing it open to our panelists. If you were to be the president of Nigeria at this moment, what is the one thing you will do to change Nigeria? What is that one thing you will do, Faith, to change Nigeria if you are the president?
Well, as a psycho-spiritual therapist, I will ask the Holy Spirit for wisdom in my every decision. So that's one thing I'm going to do, ask for wisdom from one who is wise all by himself. That's
okay. I think we seem to have lost Mrs. Angela. We seem to have lost Mrs. Angela and Mr. Dennis, I think due to network, because the weather is already changing. I want to thank every one of you who have taken time out to be on this webinar on suicide prevention and mental health issues. I want us to take 2 things home. We can control our irrational thoughts. The power to control our thoughts are in our hands. And according to, I'm a Christian, and according to what the Bible says, it says you should guide your heart with all diligence, for out of it are the issues of life. And with that, I'll leave you all on this high note. Have a swell day, enjoy your week, and show empathy to everyone out there around you. thank you so much. Thank you for joining this webinar. From us at AYGF, we love you and we wish to be with you next time on our webinar. Thank you so much for joining us. Thank you. Bye, everyone. Thank you, Faith. Thank you, Mrs. Angela. Thank you, Mr. Dennis. Thank you, everyone. Thank you, thank you, thank you, thank you so much.
Thank you, thank you, thank you. Bye.
Thank you.
Thank you, everyone.
Thank you.